Good morning. My name is Erica Melrose, and I'm an OBGYN with the SSM Health St. Joseph Hospital in Lake St. Louis. I am honored to speak to you today about a patient I recently helped through a difficult situation, one that truly proved to me the importance of being fully present for my patients. To protect my patient's identity, I will call her Julie. The day I met Julie was like any other in my office. In between routine prenatal visits and well woman exams are my confirmation of pregnancy appointments. These appointments are 45 minutes long to allow for a good history and physical, an ultrasound, and general teaching on diet, vitamins, safety practices, expected weight gain, and to answer any questions that my patient, significant other, or family may have. As I walked into the exam room, I introduced myself to my patient, her boyfriend, and her boyfriend's mother, who happened to be a patient of mine as well. As we started chatting, Julie informed me that she was approximately 14 weeks pregnant and had been afraid to come to the doctor because she has a history of daily heroin usage. Julie looked at the floor and continued to tell me that she used heroin, Xanax, marijuana, and alcohol during this pregnancy, and that she recently injected heroin with a needle that was used by 3 other people within the past week. Surprisingly, Julie was very forthcoming with this information, and I have to say, it caught me off guard. I tried not to appear shocked and listened intently to her, for I found that if you listen long enough, the patient will not only tell you the problem, but usually the cause and the solution as well. She continued to tell me about her age at first use, her family history of addiction, her lack of support from her mother, who's currently incarcerated, and her father, who is also an addict. Julie told me how she had been clean many times before, but that every time a stressful situation would arise, it would cause her to become anxious and depressed, and she would start using again. I could tell during our discussion that Julie was educated and knew that her actions were harmful to the pregnancy. However, she was unaware of the resources available to her. After listening to her story, it was clear to me that this was a woman asking for help. She was trying to do right by her unborn child. I charted minimally while Julie spoke, and when she finished, I looked into her eyes, and I could tell she was fearful about how I was going to respond. Simply put, I told her that her past was her past, and there was nothing that we could do about that. I told her that she didn't need me to tell her that illicit drug use and alcohol use was bad in her pregnancy. She already knew that. Instead, my concern was her present and her future. And these are things we can control. I assured Julie that my goal for her care was to make sure that she was the healthiest that she could possibly be, which in turn would supply us with the healthiest baby possible. But first, we needed to get Julie's anxiety and depression under control, for these were her major triggers and would cause her to self-medicate with heroin. So we discussed the multiple community resources available for detox and support. Julie seemed relieved. I started her on medications for anxiety and depression, and she stated that at follow-up appointments, these medications were helping her tremendously, and that she had not had any anxiety or panic attacks since we started them. Julie was relieved and proud that she had not used since her first appointment. I saw her monthly and then bi-weekly, and with each appointment, we learned more about each other. I looked forward to seeing her and hearing her accomplishments: 2 successful jobs, maintaining her apartment, and a successful relationship. Julie seemed to be taking this pregnancy in stride until one day she showed up for an appointment, a total wreck. My medical assistant took her to the exam room, completed an initial assessment, and when she came out, she told me that Julie was very upset and was unlike herself. I entered the room, and I could tell that she had been crying. Immediately, I asked what was going on and handed her some Kleenex. Julie proceeded to tell me that she had lost one of her jobs and it had resulted in losing her apartment. She told me that she and her boyfriend's mother had a disagreement and that her boyfriend's mother wouldn't let her stay with them. Due to these circumstances, she had been living and sleeping in her boyfriend's car. Her tears flowed freely at this time, and I offered Julie a hug, which she gladly accepted. She stated that it had been so hard to stay clean these last few days in this trying environment. I acknowledged her feelings and applauded her amazing strength to say no and to come ask for help. I told her that we would get through this, that this was just a bump in the road, and that she was a strong woman who has persevered through worse situations and landed on her feet, and today would be no different. I was appalled at the thought of my patient, who was 28 weeks pregnant at this time, sleeping in a car with the potential to turn to drug use again. I assured Julie that I would help her, and after listening to the baby and carrying out the rest of our prenatal visit, I asked Julie to wait as I excused myself from the exam room to see what resources I could find. I had to find her housing. I knew deep down in my gut that if she left this office without resources, without phone numbers, without options to look into, she would surely feel more hopeless and would turn back to drug use. Our office didn't have a brochure with housing information, and I tried looking up information myself, but a Google search can take hours. I turned to my best resource, which was my office managers at the time. I informed 2 of my managers of my patient's situation, and they were able to provide me with several options for her. Thankfully, with the help of these resources, Julie was able to find temporary housing until she could find another job, and she was able to stay drug-free for the remaining 3 months of her pregnancy. After her delivery, Julie was able to continue her hard work with Bridgeway Behavioral Health's intensive outpatient treatment system, and I'm happy to share that she just had her second child in February and remained drug-free throughout her entire pregnancy. Julie's an example of many people who have been affected by the narcotic epidemic in this country. According to a survey from the National Survey of Drug Use and Health, in 2012, which is not so long ago, approximately 669,000 Americans reported using heroin in the past year. This trend is largely driven by young adults, age 18 to 25, which coincidentally has the highest narcotics usage and is also prime age for childbearing. As a result, it's not a surprise that heroin and narcotic abuse is seen more and more in our pregnant population. We see drug-addicted patients come through our triage and delivery at our hospital on a weekly basis. Many of these patients have not received any prenatal care during their pregnancy, are secretive about their usage, and may not disclose their activities to nursing staff or physicians. For many, it's easy to view addiction as a personal failure, as drug addiction is a disease, and it has grave effects on patients' bodies, minds, and souls. These patients are the most vulnerable in our care, and among the most in need of our healing presence. They often lack strong support systems, have a low sense of self-worth, and are afraid to admit that they need help because they're fearful of judgment and the repercussions. Based on my concerns for patients' needs, I've proposed that our hospital create a handout containing resources for detox, treatment and drug rehab, and alcohol addiction rehab to be placed in our discharge folders for every single triage patient that comes through our hospital. And we don't plan to stop there. We plan to add resources for homeless shelters, resources for victims of sexual abuse, and resources for victims of domestic violence, which is 3 times more likely to occur in pregnancy. My experience with Julie has impressed upon me the importance of listening to all facets of what my patients say and to what they might leave unsaid, to try to fully understand their stories and to remain committed to treating the whole person so that they might find success in my care and beyond. And above all, I strive to wholly be present with every patient I meet and provide care to. Whether you are a healthcare provider, a medical assistant, phone triage, nurse, technologist, phlebotomist, support staff, secretary, or any other occupation that comes in contact with patients, do not underestimate the profound impact you have by simply being present and listening. It could truly improve or even save someone's life. Thank you.